Welcome, everyone. We're just going to give another 30 seconds or so for participants to join the webinar. In the meantime, as you join, feel free to introduce yourself in the chat box. Okay, I'm going to go ahead and get started. Welcome and thank you for joining today's webinar. My name is Karen Morrell and I'm with the Asset Funders Network, and I'm going to get us started by sharing a few introductory remarks. Today's webinar is going to give you a preview of a national brief, which will be released next week, titled The Impact of COVID-19 on Financial Capability Services and Asset Building, Ensuring Equity, Accessibility, and the Future of Service Delivery. AFN partnered with the Center for Financial Security at the University of Wisconsin at Madison to explore how financial capability service delivery evolved during the COVID-19 pandemic. As practitioners shifted to virtual service delivery models, we wanted to understand what these shifts meant for funders who were supporting this shift to virtual delivery models. We wanted to understand what it meant for supporting equitable and effective services. So Center for Financial Security launched a national survey to hear from practitioners and program leaders about how they engaged clients with their services during the pandemic, and how those shifts are going to impact how they deliver services in the future. And most importantly, the role that funders can play to support that virtual service delivery. CFS conducted focus groups in 6 states and regions in addition to that national survey. So they did focus groups, and then using information from both the survey and the focus groups, developed state profiles for Indiana, Oregon, Washington State, Louisiana, Texas, and the Carolinas. So the goal behind the state profiles was to highlight some of the state and regional specific characteristics and trends that were observed during the COVID-19 pandemic. So if you're from one of those states and you're on today's webinar, you had an opportunity to register for a state-based discussion that's going to be held immediately following this webinar. So you should have received a separate Zoom link to use to log on to that virtual meeting immediately following the webinar. If you're from one of those states and you haven't received a specific Zoom link, you can send a private chat message to Beth Yeet and just let her know what state you're from and your email address, and she'll send you a Zoom link so that you can attend that virtual meeting after this webinar. In addition to those, these 3 virtual sessions, we're going to do a virtual session for Washington and Oregon, a combined session, a session for the Carolinas, and then in partnership with Raise Texas, we're doing a virtual event for Texas residents. And if you are from one of those 3 states, we hope that you will be participating. But in addition to those 3 virtual discussions, our colleagues in Louisiana are gathering in person to participate in this webinar. So I want to give a special shout out to everyone in Louisiana. They're gathered at the Ashe Cultural Arts Center in New Orleans, where they're going to talk about the specific trends that we've observed in Louisiana. And they're going to be making a special announcement today. Now, I don't want to steal their thunder, so I'm not going to share the announcement on this webinar, but I would encourage you to check out AFN's social media so you can see what they're up to. Before we get started, I want to just share a few housekeeping remarks so that everything goes smoothly. But let me just start by thanking our speakers for today. You see, we've got 4 great speakers lined up. I first want to give thanks to the authors of the brief. So J. Michael Collins, Holly Leinhardt, and Molly Gallagher, who is not with us today, but they are all with the Center for Financial Security at the University of Wisconsin. And then we're also going to be joined by 2 panel speakers. So I'd like to acknowledge our panelists, David Vinson, who's from Services and Advocacy for GLBT Elders, or SAGE, and Lourdes Zuniga from Financial Health Pathways. So thank you to all 4 of you for participating today. I also want to acknowledge our sponsors. We wouldn't be able to produce a brief without generous support from our sponsors. So I want to acknowledge JP Morgan Chase, MetLife Foundation, and Wells Fargo. They not only provided financial support to make the brief possible, but also thought leadership to really help shape the content of the brief in today's webinar. Just a few housekeeping remarks in terms of the technology. At first, I just want to let you know that we are recording today's session, so you'll get a link to the slides and the recording in a few days. But if you do have any technical difficulties, please let us know by using the questions box, and you'll also see we've got some instructions for accessing the closed captioning, so we hope you'll access that. One final thing, I started off by saying I'm with Asset Funders Network, but for those of you, if you're not familiar with AFN or Asset Funders Network, just want to do a short commercial. AFN is the leading national grantmaker membership organization. We focus on advancing equitable wealth building and economic mobility. Our membership includes national, regional, and community-based grant makers. So our format for today is pretty straightforward. We've got an hour together. We're going to start with a presentation from the co-authors of the brief, Michael and Hallie. And then we're going to have a panel discussion. Hallie's going to facilitate a panel discussion with representatives from two of the case studies that are featured in the brief. Hallie will also weave in some audience Q&A during that panel discussion. So I'd invite you, please drop in your questions into the question box at any time, and we'll weave in as many questions as we can. We'll wrap up by having Hallie share some high-level findings about the state profiles, what trends we're seeing in the states and regions. And then I'll close this out by 4 o'clock Eastern so that those of you who are participating in the state discussions can log off the webinar and log on to your state discussion. So before we get started, it's always helpful to understand who's in the virtual room. So we're going to do a quick poll question just to get a sense. Okay, so you should be seeing a poll. If you could just vote what best describes your role in the asset building field. Are you a funder, a practitioner with a public entity? Are you a policymaker or other? Let's give it just another few seconds for people to vote. All right, I think we have the result, and the highest percentage are practitioners. But we also have a lot of others, so I'm curious. I'm not sure what that represents, but followed by funders and public entities and policymakers. So we're thrilled that we have so many different perspectives represented on this webinar today. So I want to get us started. So I'm just going to turn things over to two of our brief co-authors. They're also longtime AFN partners, Hallie Leinhardt and Michael Collins, to get us started. Hallie, can you kick us off?
Thanks. Yeah, thank you so much, Karen. Good afternoon, everyone, and thank you for the introductions. I'm very pleased to be here today to share this collaborative project that we've been working on with AFN, the sponsors that Karen mentioned earlier, and many financial capability and asset building practitioners and leaders who have made this work possible. We began working on this project in the midst of the COVID-19 pandemic, when it became obvious that FCAB organizations around the country had undergone a rapid transition to virtual service delivery, which raised many questions around how this shift was impacting the organizations, the programming, and of course, the clients and the communities being served. Some important context exists that really sets the stage for the launch of our study. So first, we know that even before the pandemic, more than a quarter of households in the US were considered or are considered financially fragile. And financial fragility is a term used to describe a household's ability to come up with around like $2,000 in 30 days. So in other words, to withstand a mid-size financial shock in a relatively short period of time. Second, based on research coming out early in the pandemic, we already knew that COVID-19 was impacting financially vulnerable or fragile households much more severely. And third, at this time when these more financially fragile households would be experiencing often many or multiple financial shocks at once, and therefore potentially reaching out to FCAB services with greater need, we wondered how this field-wide transition to online service delivery impacted the equity and access of receiving services for these populations in this very critical time. So in order to explore these questions from multiple angles, we designed the study with 3 components, which Karen mentioned earlier, but we'll be underscoring these different parts of the study throughout this webinar today. And we can go to the next slide. So we developed an online survey disseminated nationally to professionals providing FCAB services, which includes, among other other services, financial counseling and coaching, emergency assistance, benefits navigation, housing supports, workforce development, and many other related fields. So out of the 225 respondents to the survey, 41% identified as direct service providers, such as counselors or educators or caseworkers, and 40% identified as program managers. A second component were the focus groups that Karen mentioned, which we conducted with FCAB professionals in those 6 AFN regions, including Texas, Indiana, Louisiana, Oregon, Washington, and the Carolinas. And the focus group sessions engaged participants in conversations about successes and challenges experienced delivering services during the pandemic. And finally, we completed 4 case studies of organizations that employed innovative strategies to meet the needs of their clients. And we'll spend time with 2 of those leaders that were already introduced in the second part of the webinar. So next slide, and at this point, I'm going to turn it over to Michael Collins, the faculty director of the Center for Financial Security, to discuss the study results.
All right, thanks, Hallie. Thanks you all for being here. Thanks to AFN for making this survey happen. And then many of you, I'm sure, were part of the research study. So thank you for responding to these surveys. I know you get asked to contribute to surveys like this a lot, but hopefully there's some valuable information coming from that. So we really appreciate your cooperation in that. So I'm going to just quickly go through some of the survey results and touch on some of the sort of more comprehensive conclusions that we're taking away from both the surveys, the focus groups, and the interviews. So I'm going to focus on 3 key questions. The first one being, how did the pandemic shift to virtual services impact equity, access, and retention of FCAB services? So let's move on to the next slide. Questions here we asked on these degree of agreement scale. So blue here is never agree, and then yellow means always agree, with orange being sometimes and gray being often. And so you can imagine sort of this is just sort of a variation. Blue is basically I disagree. Think of blue as being a sort of negative response and yellow being a positive response, and then the others being somewhere in between. So the first question here is, since the COVID-19 pandemic, our programs have become more inclusive and equitable in terms of population served. So this gets at the issues that Holly was just saying, that we worried that what might happen during the pandemic is some of the groups that are hardest to reach were the least likely to be reached. And in general, we found that program managers interviewed as part of the survey were pretty positive. Only 8% never agreed with the statement. 92% agreed at some level that they have become more inclusive and more equitable. And 10% said, always agree, so very strongly so. So definitely this skews towards being pretty positive about the ability of financial capability and asset building programs to better serve the populations that are served, or more equitably serve the population served. The next question is specifically around barriers for Black people, and those have the same kind of trends, where about 92% agreed, and even stronger said always agree. So definitely strong in that direction. So next slide. Next thing we looked at is some questions about the program itself, so aimed at the program managers and others, and asking whether, again, where blue is never agree and yellow is always agree, whether they were better able to recruit and retain clients and their services. This wasn't nearly as positive. Recruitment was certainly an issue during the pandemic. And here we had 17% never agree, and then the majority say sometimes agree. So recruitment seems to be an issue that was a bit of a struggle, and we see kind of a similar pattern across these others. Now, these aren't strongly, negative. We don't have a high negative agree, but still it's sort of skewed towards that more negative side of the distribution. So the next question is around the same or better outcomes. Sometimes agree, again, was the most common here, with only 6% saying always agree. And then in terms of able to serve our clients and consumers more efficiently due to an increased use of remote technologies, a little stronger here, 14% said always agree. And a few more percentage points said often agree versus sometimes agree. So a little more positive on the efficiency side, but some concerns about the outcomes and about the ability to recruit and retrain. And we'll hear that, I think, in part of the discussion later today too. Next slide. So I think the general consensus from a lot of these data, as well as what we heard in interviews and focus groups, is that there are some advantages in terms of service delivery when you're doing virtual work. You're able to connect with more people. You're more flexible in terms of how and where you meet them. People can talk to you on their way to work, or people can talk to you on hours, or hours maybe when they'd otherwise be working. So that helps to reach a more diversified clientele. I think a big question going forward is really seeing who is not being served and who is being served by these methods. It's going to change the mix of who's able to come in and how they're able to see people, see the caseworkers that they're working with. And so we want to keep an eye on that going forward. But we do think in general, it has expanded the group of people who can be engaged in services. Next slide. Next question we asked was about the demographics of clients and how that's changed. Again, we were a little worried that what might happen during the pandemic is, for example, we thought older people would really struggle with something like Zoom. And so maybe they wouldn't be as likely to be served, or maybe low-income people wouldn't be as likely to have the ability to do virtual services because they wouldn't have high-speed internet. And what we see here is this orange here being more and blue being fewer. So on every one of these different measures, we see more Black, more English as a second language, more families, more Latinx, more LGBTQ, more low income, more seniors, more women, and almost more youth. The youth is kind of a split, probably the closest of these, where there was almost a match between fewer and more. But in general, organizations are saying they're better able to serve some of these populations. And we were surprised, especially by the low income and senior findings, that maybe some of the technology barriers we thought were going to be an issue are less than we thought. Next slide. So the second key question we were going to look at is how effective were these virtual modes? So first question, we looked at the shift and how it impacted equity and access. The second question is about the effectiveness of these virtual models. So we'll go on to the next slide here. So effectiveness is obviously tricky to think about measuring in a survey like this. It's people's perceptions of effectiveness. But one thing we wanted to look at was, has there been a shift over time in how people are served? So the blue is 2019, the orange is 2020, and the gray is 2022. So we're getting a sense of what people were doing before, during, and sort of after. I guess we're in the after phase of the pandemic, at least less pandemic mode than before. And you can see that things like telephone, nearly doubled. Same with text, nearly doubled. Video call, much, much higher. Almost 6 times the rate of video calls, and that seems to have stuck, whereas the text and phone went down a little bit after the peak of the pandemic in 2020. That seems to be sticking around. Online apps, more tripled, much more use of online apps, and that seems to be going forward. And then in-person sessions, no big surprise, in-person sessions really dropped in 2020. It was probably mechanical in some ways. But the level that it's at now is about 2/3. So, about almost a third, a 30-point drop in the percent of people who say that at least a quarter of their clients are served by in-person sessions. So, we see this as a real shift in how service is delivered. And we'll talk more about this later, but this shift is probably going to have some pretty profound ongoing effects on how the field operates. Next slide. We do see this increase in access adding to flexibility. You could think about the issues that maybe families would have in getting to services, having to come to an office because of transportation or childcare. Those barriers are much less when you have to deal with a text message as opposed to actually driving somewhere, or maybe doing a class or counseling on the phone or on a video call versus having to come to an office. I think the other thing we have to remember is that during the pandemic, people were highly motivated to seek out services. So, they saw what was happening around them. They felt the economic effects of the pandemic. And so they were motivated to do things like build emergency savings or figure out how to navigate assistance programs or get rental relief or whatever it might be, deal with pandemic assistance. So that sort of maybe provided some context for people to jump through some of these hoops and get into the services in ways that maybe they hadn't been before. But I think we still have concerns about recruitment and retention. And we heard a lot of, when we talked to providers and others, we heard some concerns about that there are some ways that virtual services just don't match up. We aren't able to do the same kind of work that we're able to do in person. And we worry that we may be sacrificing some of the quality as we're increasing the quantity. So try to think about ways that we can make sure that our quality is improved even with these virtual services. So next slide. So as we turn to the issues of demand for services, we were worried that one thing that might happen during the pandemic is that organizations saw this influx of support and demand for services, but they just couldn't keep up after the pandemic. So there was this, attention to some of these issues, and then not so much attention going forward. So again, this is back to the scale where blue is never agree and yellow is always agree, and then sometimes and often are kind of in the middle. So a lot of organizations did say they saw a significant increase in the demand for services. 23% said always agree, and 37% said often agree. So a lot of increase in demand for services. We had sort of a mixed story on increases in government funding. It seems like some organizations saw an increase and some didn't. So a third said never agree, but others did seem to see some increase in government funding. Pretty similar story for donor funding. Pretty similar pattern that we see with government funding. Foundation funding, again, very similar. So, some organizations seem to be getting some increase in support, but not consistently across all organizations. In terms of staff shortages, we thought we might see a higher rate of organizations reporting staff shortages and volunteers. It's not as high as we thought. I guess it depends on what your prior is. Although 15% always agreed that they're facing shortages of staff and volunteers. And so if we add that to the 24% who said often, it's over a third, maybe closer to 40% of people who are of organizations that are struggling with staff and volunteer levels. And this actually might be worse today, given when we did this survey and where labor markets are now. And then the last question was about technology and whether organizations are able to keep up with technology. Only 14% always agreed that they were able to keep up with the latest technology. So during the pandemic, organizations quickly shifted to using technology, and now they have to keep up with these new technologies. And this seems to be an area where some organizations are struggling and maybe an area that needs attention going forward. Next slide. So the last question I'll address is what we've learned as a field from this experience going forward. So next slide. So the first question we had was, is your organization financially secure enough to continue for the medium and long term? Only 8% said never agree, so I guess that's positive, and 18% said always agree. The rest were in the middle. They sometimes or often agreed. I think this is kind of a mixed story. More positive than negative, but still some concerns about financial viability. Next question is more about what organizations perceive to be the best way to conduct services. So the question is around counseling and coaching, financial coaching and financial counseling, and if they're always better when conducted in person. 12% always agreed and 8% never agreed, and the rest were somewhere in between. I think as a field, this is something we have to think hard about, and whether we think that the virtual services are good enough, or if it really is sort of a complement to the other services that we're providing. Another question was about remote and technology-based services and whether they make it harder for clients to trust our program. Only 1% always agreed, which I think is quite positive, and 26% never agreed. So technology doesn't have to be a barrier in terms of organizational trust of whether clients believe that the organization has their best interest in mind. The next question here is about brand identity, and is our program's brand identity attractive? Is the identity attractive for the program populations that we serve? 21%, 1 in 5 agreed. It was one of the higher rated questions that we had. So it does feel like organizations have invested in who they are. That seems to hold up even in a world of virtual services without that sort of brick and mortar presence for clients. So it seems to be a positive signal, at least to me. And then finally, our organization regularly consults experts to design and improve our financial capability and asset building programs and services. 14% never agreed and 13% always agreed. Again, I think there's a lot of variation across programs, just like we saw across different forms of funding and whether organizations felt like they were financially secure or not, given the kinds of funding sources that they had. I think this is a measure of investment in the infrastructure and in the future ability to perform. And, I guess this is slightly more negative than positive, but it definitely suggests that there's a lot of variance out there and varied needs among organizations. Next slide. Next set of questions are about the financial security of the organization. 18% felt like they were always agreed that their organization was financially secure enough for the medium and long term. And generally, I think that's a positive signal. Only 8% never agreed. This is the same slide again. I apologize. Let's go one more forward. If you felt like you were going back in time, you were. All right, so some of the takeaways here. So virtual services can definitely reach a more diverse population. People like the flexibility. They like the ability that they can have things tailored to them. But I think we see a lot of variance out there in terms of the clients that are served and the organizations. And some are going to need more infrastructure, so to speak. They're going to need more investment in their people and their IT systems, and just ongoing training and support to be able to manage those services. I think our major takeaway from all this is that this sort of forced experiment with virtual services during the pandemic taught us that these services can be useful, but they're really a complement. They're not a substitute. We don't see a world in which financial capability and asset building services are going to 100% all virtual. It's going to be some combination of in-person and virtual, getting a text message, doing an online activity, and then having a meeting. And these things are going to be working together in different ways. I think what we need to do next is better understand how to do these multi-mode service strategies. Which are the clients that benefit from an initial meeting and then some virtual follow-up, and which are the ones that are better off with a virtual initial meeting and some in-person follow-up? Which are the best, respond the best to text messaging? Which are the best to perhaps do phone sessions complemented with some video sessions, and then maybe a class and never have an in-person one-on-one session? So we need to do more work to understand which clients get the best outcomes using what mixes of modes and strategies. This is obviously a challenge going forward, but I think if we can get this right, we can serve a larger group of people, a more diverse and equitable set of populations to serve, and also do it better and perhaps even more efficiently over time. Next slide. So looking ahead, I think we're going to be thinking a lot more about this digital divide, both at the organizational level, which organizations are behind in the digital divide, which service providers are, and also the issues of clients themselves and how do we best meet clients where they're at. This is going to mean investment in people, in technology, in training. And I think we have to keep using this equity lens. We don't want to default to a service because it's just more efficient for the organization. We want to make sure that it serves equitably different groups, regardless of the racial background, their other kinds of backgrounds they might be coming from, their rural urban status, their income level, whether they have access to high-speed internet, those other kinds of barriers that they might face. And then finally, and this I think will come out with our next discussion, is how we can learn from each other. What have organizations done that's worked well? What can we learn and replicate going forward? So next slide. Excellent.
Thanks, Michael. Yeah, thanks for providing a summary of those findings. That's really helpful. And I think it cues us up for our next conversation and switching gears to the two of the organizations that are highlighted in the study, who have innovative strategies that they've implemented to reach and meet the needs of the communities that they serve. Karen introduced David Vincent and Lourdes Zuniga, and so I'm going to go ahead and quickly turn it over to David to give a short summary of his organization before I then turn it over to Lourdes and we do some panel questions. And I do invite the audience to please continue to submit your questions in the Q&A. You can submit questions for Michael as well. I'll facilitate that kind of following some of the panel questions that I have prepared in this next half. So with that, I'll hand it over to David. Thank you.
Great. Thank you so much, Haley. We can go to the first slide. Hi, everybody. Thank you to Asset Funders Network for inviting me to talk with you today. My name is David Vincent. I am the Chief Programs Officer over at SAGE. For those of you who may not know SAGE, SAGE is the world's largest and oldest organization dedicated to improving the lives of LGBTQ+ elders. We were founded in 1978 to provide essential services to the most vulnerable and underserved LGBT community, our elders. SAGE advocates for federal and state policy changes that address the needs of LGBTQ+ elders. We provide education and technical assistance for aging providers and LGBT community organizations through our National Resource Center on LGBTQ+ aging. And we provide cultural competency training nationwide through a program called SAGE Care. We have a large programmatic virtual footprint virtually and throughout the country in New York City, where our home base is, and we offer a continuum of age and LGBT competent programs and services that improve the lives and health and well-being of LGBTQ+ older adults. You can go to the next slide. For the purposes of what we do, right, we're about LGBTQ+ age elders. As they age, they face challenges compared to their heterosexual or cisgendered peers. This is due to a lifetime of discrimination that affects their lives in all aspects of their lives. So when we think about LGBTQ+ elders, compared to non-LGBTQ+ elders, they're 2 times less likely to be partnered and 4 times less likely to have children. And things have gotten much better in the community through the legalization of marriage and the decrease of stigmas. However, older adults continue to face discrimination through ageism and unfortunately don't get the types of support that they need as they age. Many older LGBTQ+ older adults experience high levels of ongoing discrimination, particularly those from BIPOC community and those of transgender experience. Unfortunately, LGBTQ older adults have challenges accessing healthcare. Many experience discrepancies compared to their non-LGBTQ older adults, things like mental health and HIV and substance abuse and diabetes. Additionally, because of workplace discrimination and underemployment, many experience higher levels of poverty, food, and housing insecurity. This discrimination, unfortunately, also impacts how they access supportive services. They're less apt to do so. As I mentioned earlier, because they're less likely to be partnered and have children, they also find themselves struggling with social isolation and have thin support networks. We can go to the next slide. So as we think about the issues affecting LGBTQ+ people and their financial wellness, it's important to remember for the LGBT community living in the US, many folks are surrounded by really conservative minding folks, and that can really affect LGBTQ people's identity and their whole livelihood. Unfortunately, many states out there throughout the country will discriminate against you in the workplace and even terminate you based on your sexual orientation, gender identity, or gender expression. Fraud, unfortunately, occurs not only just from the outside sources who know exactly who you are and what to say and how to talk the talk about accessing your financial information, but also from friends and loved ones who they entrust with their information. Going through the process of trying to resolve these issues can be rather intimidating for many, as they feel like they can't rely on others in the time that they need. Imagine not being able to turn to a trusted community like the law enforcement or a higher authority when you have some challenges. But that's often the experience that many LGBT folks experience because of the histories of discrimination, abuse, and lack of trustworthiness, that the first people they want to turn out to cannot be the people who can help them. It's this history of discrimination, victimization, and violence that many LGBTQ plus older adults feel as though their trusted options are limited, especially when it comes to their finances. That's why the work we do at Sage is so incredibly crucial for many. And for many folks, we are their only trusted option. Haley?
Very good. Thanks so much. And I'm going to turn it over very quickly to Lourdes to do a quick summary on financial health pathways.
Thank you, Haley. It is my pleasure to be here. Thank you for the invitation. We at Financial Health Pathways are thrilled to be in this seminar. My name is Lourdes Zúñiga. I'm the Executive Director and founder of the Financial Health Pathway, a nonprofit operating in Texas. If we can go to the next slide. So our mission, we first and foremost love having in our mission, one of the core things that we included in this new chapter for our organization. We are a community-centered organization that focuses on improving the financial health of Texans. And when I say community-centered, it's because everything we do is centered around community needs. And by that, I mean, we ask community what their needs are. We don't make assumptions. So through that, we advocate on behalf of the underserved. We provide them with education and resources to achieve financial freedom. If we can go to the next one. We did a study of, the recent census and other studies that reveal a lot of the issues that we already knew, but we wanted to emphasize the topics that we wanted to tackle in the upcoming 3 or 4 years of our operations. And that means supporting women and youth. Based on the statistics, they are more propense to live in poverty, and obviously people of color who we reach very actively in the community. If we can go to the next slide. In this chapter for our organization, we have a 3-intervention model, not just the individual with classes, which was our model before, but we actually pair them with an asset building initiative called I Save Texas, that is a matching savings. And then we also do community intervention through capacity building trainings. And we added an advocacy arm in our policy intervention because we do want to advocate for systemic change and make sure that we're not just addressing the individuals that we serve, but we're also changing the policies so that our environment can be, can actually make the field more accessible for people to practice what they know. If we can go to the next one. So one of the programs that we just released in the past couple of years, we've been working with the I Save Texas. This is a technology-based program that we decided to launch, and it was conceptualized before pandemic, and then pandemic happens. So through this program, we are incentivizing people for savings, and we have statistics that were so telling about the communities and also about the assumptions that we make when we serve communities of color, when we serve communities that are low income. We realize that people really want to save, people really want to access to financial services, and there is a lack of trust and a component of not trusting the system that gets in the way of these practices. But through community partners that we call host partners, we realize that that trust is built over time, and they are actually more recipient and receiving of the message and to incorporate these practices in their lives. If we can go to the next slide. We have a junior academy, as I mentioned in our previous slide. We have a very intentional way to address the communities we're serving, and we do realize that while it's important to serve all communities, we emphasize in serving youth. This is our career exploration and readiness initiative that what it wants is for students to understand that we have different paths to higher education, not just college, and the access to these pathways in higher education is not just in student loans. There's a lot of other options, and there's a lot of different career paths that they can contemplate and look into. And so we start in middle school, and then we go into high schools as well. Next slide. This is our capacity building trainings. We work with school districts and policymakers. We passed a bill, created a class for financial education in high school, and now we are in the implementation. So we also do, because it's tied to the implementation of the bill, we do a lot of trainings with school districts around Texas. And the next slide, this is one of our pride and joys. This is our financial justice program. It started before pandemic and continued through the pandemic through this partnership with Experian and the Williamson County Court. We are almost having a diversion program where we dismiss minor traffic offenses cases and waive the fines and fees for the participants that are sent to this program by the judge. And to date, we have dismissed almost 2,000 cases and waived over $500,000 in fines and fees, and kept that money on the pockets of the people that really needs them the most. And this program has been awarded 4 different awards around the state of Texas. The next slide is basically just our awareness of different issues, and we do that through our Financial Capability Summit and also our Financial Inclusion Week. That were paused during pandemic, but we continue working with legislators around the state of Texas. All this to say, our collaboration model relies on partnerships from different organizations. As you can see, we partner with philanthropic organizations, financial institutions, government organizations, and community organizations that everyone plays a role in what we do. We are a very small capacity of 1 person. I'm the only staff member for the organization, but we leverage on the partnerships that we have with all these different players. And what I do is when I join into a partnership with any of these organizations, what we try is to bring community awareness of, critical issues that we have in the community and tackle those through the roles that every partner had in this, whether they are government organizations or public officials that are perhaps working on legislation and systemic change, through philanthropic, so we can get the support and the funding that we need to get those pieces of legislation passed or bring that awareness, or the financial institutions that are also partnering with us in many capacities, funding, and also through volunteer opportunities and working with communities. And obviously our community organizations that are the ones that we get to work really closely to understand who they serve, how they're aligned with the people that we want to serve, and how do we leverage that trust that they have with their service providers, but also they become a client of our organization, and we make a community more. What we try to do is to tackle issues that are critical in a more holistic way. It's not just through financial education and classes that are more of a passive, perhaps, initiative, but also how do we trigger actions and how do we do things that are significant for our systems and for our communities. Thank you.
Thank you so much. Okay. We have a lot of great information that was just presented. And so I kind of just want to dive right into some questions for our panelists. I'm going to turn to you first, David. And you addressed a lot of this in a bigger way in your summary of your programming, I think. But maybe you can think about this in more of specifically looking at the pandemic, this question. So thinking about some challenges or some barriers that your organization has faced in seeking to meet the unique needs of the communities you serve, and how you worked to overcome these obstacles or challenges.
Haley, that's such a great question. LGBTQ plus older adults went into the pandemic already with significant challenges, right? They were already underemployed. They already faced significant discrimination. And then you throw COVID in, folks who were disconnected from family, they didn't have spouses, and they were alone and they were struggling. Many of them had challenges accessing resources even before the pandemic. So now all of a sudden, we needed to figure out how to reach them, create resources in order to address their needs. When I think about just financial wellness, right? The teaching about financial wellness, there's lots of financial wellness applications out there, lots of them. And some of them actually speak to the needs of LGBTQ populations. None of them speak to the needs of LGBTQ older adults. So it was important for us to figure out how to do that. And how do we talk with folks? How do we address histories of underemployment and discrimination in a way that provides information, but sort of takes away the shame, right? Takes away the shame of them not being as prepared for their financial retirement years and how to manage themselves through COVID, right? They didn't have a safety net. So it was really important for us to figure out how to do that.
Thank you. That's really helpful. And I'm sure we could dig into that even more. I'm going to pivot just a bit. And I have an audience question that actually works well with one of my prepared questions. And I'll turn to Lourdes. So actually, both of your organizations provided excellent examples of programs and organizations that have leveraged technology through apps and web-based tools to increase the financial security of your clients, even beyond the virtual services that many organizations pivoted to during the pandemic. For many organizations, this transition may sound daunting. So Lourdes, can you talk about how you formed or launched that app partnership? I think it's called Saver Life. You can correct me if I'm wrong, and how you overcame any fears or apprehension associated with that, with introducing that new technology tool to those you serve. And the audience question was asking for an example of an online app or tool. So I felt like that really fit the bill.
Yes, thank you for that question, Haley. And, you know, it's so interesting that people are very, we all stressed out about how do we launch initiatives during the pandemic. A lot of people ask me, why would you do that? And, you know, my answer is always a twofold. This was conceptualized before pandemic. I always knew that the future of banking will have to be some way in technology based, because that's what we're moving forward, and there's more technology available, and there's a lot of fintech available. The other thing is, I always say to providers that are asking me all the time, perfection is the enemy of progress. And when you work with communities that are historically neglected, you can't just have a cookie cutter way of approaching things. So for me, it's always like exploration mode. I always knew that I would have to be flexible and adjust to any challenges, because again, our communities, and I think everyone through pandemic, we were just trying to survive. So why don't just take that pressure off and say, you know what? I feel like these are things that my work might help providing aid to people. This matching savings, what it was, is trying to provide some aid to people during the pandemic. And through that, we decided to do a matching savings. And we asked for a very small amount of money for people. And so for me, it was like, what worked and what didn't. The beauty of all this is that at the end of the day, 2 years into this program, recruitment was hard, and I always knew that that was going to happen. But engagement was high. 70% of the people who reach out to engage in this platform and link their bank account. What I also learned is that a lot of people are using these fintech platforms like PayPal. Instead of linking a bank account, they link a PayPal. So there is a lot of things that I write them down. I take notes on all these issues and say, you know what? I learned something. I don't see adjustment as a loss or as something that will stress us out. I actually said, we're going to work with our communities and we're going to ask for feedback from them to know what works and what doesn't, and we'll make adjustments as we go. And so for me, that's kind of like the takeaway lesson, is to be flexible as a leader, to give communities the opportunity to co-write those programs with you, because at the end of the day, they are the ones that are supposed to tell you how to serve them, not for us to make the assumption of, this is what I want to give you. We're supposed to ask them, what do you need? And when you do that, the stress goes away, because you cannot have that flexibility and that adjustment part embedded in what you already are initiating, if that makes sense.
I love that. Thank you. So I'm going to turn back to David and ask, where do you see the potential for innovation in serving financially vulnerable populations?
You know, I think Michael really hit it in the report. Like online and virtual programs are really exciting opportunity for many older adults. I think when we think about older adults, I think oftentimes the general perception is that, oh, older adults, virtual, they get, that's so not true. It is so not true. So we offer virtual programming at Sage. We have a virtual financial wellness platform called Sage Sense. We have users that are 94 years old that are navigating through that. So we have to sort of break through this sort of stereotype that older adults don't use online platforms, because they do. But we have to be mindful and strategic about how we design it. We have to speak to them. We have to represent them in images. We have to speak to language that really talks about their experience.
Thank you. I'm so glad you brought that up, David. That's a really important note, and I think we do mention that in the report around perceptions versus what we're really working with. And so thanks so much for noting that. I have one more question that I'm going to pose, Lourdes, and before we kind of move into, I have another question from the audience that I'll pose to Michael in just a moment, but I wanted to ask one more. So what are some strategies that you've employed as an organization to identify and address some of these emerging or ongoing financial issues that many populations are facing, especially given the rapidly changing struggles? And that is from like the pandemic job loss to new benefits and government programs that are constantly cropping up, and then inflation and scams, et cetera, et cetera. So how do we face these challenges? Go ahead.
How do we get to those challenges? We are very in touch with our clients and our partners. We are constantly monitoring and asking for feedback, whether it's a focus group, a survey. We're always asking for feedback to our clients because, again, having this in our mission that we're a community center, it forces us to constantly ask for feedback and not have the assumptions and not stereotype people, as David was mentioning. We want to know. And so oftentimes, a lot of what we do is based on that feedback. They say, we don't know about student loans. So we do a lot of the work that they prompt us to do. And so by doing that, it creates a relationship of trust. And so the other thing is we look at the statistics of our region. We look at the opportunities, and we're very in tune with community needs. And I think that the more we do that, the more we are responding to those needs in a way, as I call it, working in the intersection of health and finances is a tricky thing because it's not something you will expect. But because we're so in tune with our clients, we're able to identify perhaps it's not that they have a medical need, it perhaps is that they can't afford to have medical insurance. So we work towards that, and we work towards making those connections that people might not see, but our job is to make those connections with the community, with the service providers, with the public officials that draft legislation. And so once we do that, we wouldn't be able to do that if we weren't in touch with our clients. So we take our clients' trust very seriously, and we try to respond to all those challenges that are driven by community. So we like to think that we're a community-driven organization.
Very good. Thank you so much. Michael, I'll just end with this quick question surrounding data. And so the question is, did you get enough responses on the survey to cut the responses by organization size, geography, program service, et cetera? I think I know the answer, but I thought I'd let you answer and kind of put it out there.
I guess the answer is it depends. We have done some analysis of some subgroups, but they get really small. And so you're probably not going to see us staking a strong claim on some of those results, especially by different regions. I think we don't have great measures of organizational size. We have things like, number of programs or number of staff. And my prior going into this was that the big organizations would be all, roses and whatever, like all happy, positive, and small organizations would be struggling. And it's really a mix. I think there is just a this field is highly varied. We have smaller community-based organizations, we have larger organizations, and you can't really generalize about, the big ones do virtual and the small ones don't. It's a varied field. As a result, it's hard for us to come away with any precise conclusions for any particular subgroup. But I think our broad conclusions about the shift to technology and being thoughtful about matching the technology to the client type and really thinking about these mixes of services, I think those are valid across all these different groups.
Thank you. And with that, I do want to thank Lourdes and David and Michael for your time and the wealth of information that you provided today in what felt like a really short hour, I have to say. As I mentioned earlier, in addition to the national reach of the study, we focused in on 6 different AFN regions. So I'm just going to present some very kind of quick findings that are an overview or our key themes across these regions. Oh, I see the slides. Thank you. So across regions, we found that organizations have been flexible and innovative in the ways that they connect with clients. And Louisiana practitioners often pivoted to a hybrid approach of meeting clients in order to lessen the issues created by fully remote services. And this approach took creativity and flexibility in figuring out how to safely meet in person, for instance. Many organizations find that the shift to virtual services has allowed them to reach more people, yet the digital divide continues to be an issue for many populations. And notably, over half of the Indiana-based survey respondents often or always agree that their FCAB programs have become more inclusive and equitable since the COVID-19 pandemic. And we do see this same result echoed in many of the regions as well. Practitioners in the Washington focus groups noted that both digital literacy and access to broadband and computers can be a barrier for many communities, including rural, non-native English speakers, as well as urban populations. Next slide, please. And across the board, we heard that organizations have focused on reducing barriers to FCAB services for people of color. And this was noted in Michael's presentation as well. For instance, practitioners in Oregon felt their organizations were talking about equity more in purposeful ways with concrete actions, such as implementing more free services in order to increase inclusivity. And finally, virtual service delivery proves challenging in many ways compared to in-person services for both clients and practitioners. And seeking to overcome this challenge, organizations in North and South Carolina discontinued some services while increasing capacity of others, which was an intentional pivot taken to meet the needs faced by clients in that moment. And many Texas focus group participants noted that practitioners have shouldered a heavy and stressful burden during the pandemic, providing support for staff through trainings, hiring additional staff or volunteers, and mental health and well-being initiatives could be beneficial for staff retention and morale. So on that note, I'm going to turn it back over to Karen to wrap up. I just hope that that kind of queued up our next breakout groups with our regions. And I just want to thank everybody for being here and for all of the panelists. Like I said, they provided us with an immense amount of information in the last hour. So thank you, Karen. Take it from here.
Hallie, your conclusion, your last few slides, I think were the perfect transition as we log off from this webinar and folks log on to the state-specific conversations. Hopefully your key themes will get those conversations started. So we are with less than 60 seconds left. So I just want to say a quick thank you both to our speakers, Hallie, Michael, David, Lourdes. Thanks so much for contributing your expertise and your perspective. I also want to say thank you again to our sponsors, JP Morgan Chase, MetLife Foundation, and Wells Fargo. We appreciate your support. So thank you very much. Look forward to getting a link to the slides and the recording in the next day or so. Thank you, everyone.